The new guidelines deliver a clear, common sense message to the American people. Eat real food. What a concept! The U.S. faces a national health emergency. Nearly 90% of healthcare spending goes toward treating chronic diseases, much of it linked to diet and lifestyle. More than 70% of American adults are overweight or obese, and nearly 1 in 3 adolescents have pre-diabetes. 1 in 3! Diet-driven chronic diseases now disqualify many young Americans for military service, threatening national readiness and limiting opportunity. These guidelines return us to the basics, Senator Kennedy said. American households must prioritize whole, natural, dense foods, protein, dairy, vegetables, fruits, healthy fats, and whole grains, and dramatically reduce highly processed foods.
Today marks the beginning of the end of an era of medical dogma on nutrition. For decades, we've been fed a corrupt food pyramid that has had a myopic focus on demonizing natural, healthy, saturated fats, telling you not to eat eggs and steak, and ignoring a giant blind spot. Refined carbohydrates, added sugars, ultra-processed food. This study in JAMA now shows that 60% to 70% of kids are getting their calories from ultra-processed foods. That's an epidemic. We now have a generation of kids addicted to refined carbohydrates, low in protein. The old guidelines had such a low protein recommendation that we are increasing that by 50 to 100%. Kids need protein. These new protein guidelines are designed for American kids to thrive, and they're based on science, not on dogma. We have 40% of our kids now with a chronic disease. It is not their fault. This is something that is the result of bad advice from the government and a medical establishment that for decades peddled research from a flawed 1960s model. Today we are setting the record straight. This is not a willpower problem of our nation's kids. This is something adults have done to kids, and we're going to fix it.